Want some ideas for something different, tasty, and healthy for dinner? Check out the Food Corner for videos and downloadable recipes at newstarextra.com/food.
In early December, the members of the House will be asked to submit their bill requests for this next legislative session. And then in early January, members of the House will be asked to submit their final drafts of the legislation that they plan to carry in this next session. And so we will begin with pre-session committee meetings in about 2 weeks into January, and then our session officially starts the first Monday of February. And so we're coming up against the deadlines to really begin the work for this next session. And it's an exciting time in Oklahoma, and I am awfully grateful and thankful for the opportunity to serve. It's going to be a pretty comprehensive package. One of the things that we're going to do is to try to double the number of compressed natural gas stations within our state. I think currently we're at 26 stations, around that number.
That's where you can go to fill up your car.
Yes, sir. Yes, sir. And so what we want to try to do is at least double that number to maybe 52 over the next 5 years, and try to place those stations in a regional location so that more Oklahomans can move in that direction. In addition, we would be providing incentives and perhaps subsidies to schools to convert their fleets of buses and their transportation vehicles over to compressed natural gas to be utilized to take advantage of the infrastructure that we want to implement within our state. Also, there will be incentives for individuals as they begin to build new homes and new businesses to consider geothermal units for either cooling or heating those facilities. The Speaker is going to offer some pretty significant tax incentives, I believe, for people to start moving in that direction, just so that we can be more responsible and hopefully more efficient with the resources that we have available. I think the impediments would be the conversion, converting our current system over to a new system in that situation. And so, there's going to be some upfront cost, especially when it comes to converting vehicles, for instance. But your question specifically, I think, applied to homes or businesses.
Just in general.
Just in general. I know that the geothermal, I guess, and that's a situation, the Capitol building is actually contains, I think, the state's largest geothermal unit, and I think that that's important that government lead by example in these kind of initiatives. But the thought there is that while there may be additional cost on the front end because the transition or the new technology is a little bit more expensive, that the state would have to ultimately see this project as an investment, or see this endeavor as an investment for the future. And I think that while paying a little bit more on the front end to either convert vehicles or for the new technology, the new infrastructure for homes, over the course of time could really result in tremendous cost savings. And so we need to try to keep focused on the big picture as we make this transition. But it's a new day, it's a new challenge, and it's a new opportunity for our state. And given the resources that we have with the wind technology in western Oklahoma, and I understand that there are some cities now in western Oklahoma, smaller cities, that are completely reliant upon wind power. And the more that we can develop that technology, and the more that we can utilize the resources within our state, such as compressed natural gas, and maybe be a model for the rest of the nation, that could lead to tremendous possibilities for Oklahoma. The healthcare reform proposal is going to be very comprehensive. It's going to include several elements. Currently, we have a subsidy program in place that is referred to as Insure Oklahoma, and it's actually a model that's gained national recognition. It's a situation where, through the tobacco tax, the state pays a portion, as well as the federal government. For every tax dollar we put toward the program, the federal government matches that with approximately $3. And so in the model that we've developed within Insure Oklahoma, the employee would pay 15% of the premiums. The employer would pay 25% of the premiums, and then the state and federal government pays 60% of the premiums. So it is truly a public-private partnership. These are private plans. It's just a situation that if the employer or the employee, I should say the employer and the employee meet the eligibility guidelines, then the state and federal government would pay 60% of the overall cost, with the rest of it being split 25 for the employer and 15 for the employee. But we hope to build upon that. As a matter of fact, we've already increased our income guidelines to allow more businesses and more employees to take advantage of the program. But the expansion is currently pending federal approval. The federal government kind of has been in a holding pattern until after the presidential election, as far as granting any new expansions or any new waivers for states to expand programs like what we're talking about here today. But that's one element of it. Another element is to reform the individual market, the private market, to allow providers to offer basic preventative plans using relaxed mandates that may be more affordable and more attractive to what we would consider the young and healthy population within our state, who may not see the value in paying a very high price for a health insurance premium. And a lot of what we have right now is, because of the way the system is set up, we have to spread those risks around. And so for a young person who is healthy and doesn't feel like that he or she may need insurance, for them to pay $400 or $500 a month when they don't feel like that they could utilize the services is a problem in our state. And we have approximately 43% of our uninsured population fall into that category. So the idea would be to offer kind of a basic preventative health care plan with catastrophic coverage that would be free of all the mandates that are currently in place that tend to drive up the cost of insurance, so that more young and healthy Oklahomans would consider and see the value in obtaining a health insurance plan. Well, I'm very concerned about the HOPE initiative, the whole concept, because what ultimately happened. First of all, let me tell you that in Oklahoma, over the last 4 years, and I'm very proud of this, but over the past 4 years, we've actually given the largest pay increase to teachers of any state in the nation on a percentage basis. Now, to be fair, we've had a lot of ground to cover. We've had a long way to go to catch up. But we've made substantial increases in regards to funding, especially in the area of teacher pay, over the last 4 years. And I think that we're on the right track, and I hope that we would continue down that road in making sure that our teacher salaries are competitive with those of other states. That being said, to tie the hands of the legislature through a constitutional amendment that basically would say that X amount of dollars, regardless of how much money we have in the state coffers, has to go to education, means one of two things. Either we've got to increase taxes, or we're going to have to cut services from other areas of government that we would think are important, such as public safety, healthcare, corrections, transportation, things of that nature. And so I really feel like that the process is designed to allow the people to have say-so into how the state dollars are spent through their elected officials. And my concern is that if this constitutional amendment passes, it says that we have to increase classroom funding to the tune of $850 million to begin with, then that really kind of ties the hands of the legislature to not be able to work out the priorities of state government.